Propofol, also known by the trade name Diprivan. Propofol is indicated for anesthesia, intubation, and sedation in critically ill patients. Propofol works as a hypnotic agent, producing amnesia, and has no analgesic properties. The therapeutic classification of propofol is a general anesthetic. Special considerations for nursing include using cautiously in those with cardiovascular disorder, lipid disorders, or increased intracranial pressures. That propofol can cause apnea, bradycardia, and hypotension, and it is common to have burning and pain at the IV insertion site. It is important to note that propofol can turn the urine green, which all practitioners and patients should be aware of so that they are not shocked by this. And it is important to assess respiratory status and hemodynamics while on propofol. The patient's airway should also be maintained and monitored, and level of sedation should be constantly reassessed. As mentioned, propofol does not have any analgesic properties. Therefore, other analgesics should be administered in all patients on propofol, as the sedation may make them unable to report any pain. It is also important to know that propofol is contraindicated in any patients with soybean, egg, or glycerol allergies, all of which are components of the IV solution. Lastly, it is important to know that in patients taking high doses, greater than 5 mg per kilogram per hour, for long-lasting infusions greater than 48 hours, there is a risk of developing propofol infusion syndrome. This syndrome is characterized by rhabdomyolysis, cardiovascular collapse, and metabolic acidosis. If this occurs, the physician should be contacted immediately, and in most cases, propofol is stopped and replaced with an alternate agent.
This has been another episode of the Nursing.com MedMaster podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.